Hi, everyone. My name's Jen Goldsack, and I'm CEO of the Digital Medicine Society, or DiMe, a global nonprofit dedicated to advancing the safe, effective, ethical, and equitable use of digital technologies to optimize health. I'm delighted to be joined by my colleague, Dr. Ryan Vega, Chief Officer for Healthcare Innovation and Learning at the Veterans Health Administration today, so we can tell you more about the Playbook Digital Healthcare Edition, the essential guide for successfully deploying digital innovations to improve lives. Ryan, do you want to talk a little bit about the impetus behind creating this open access resource and why we're looking to digital innovation in this moment?
Yeah, Jen. Well, I think there's a few components that become really important. One, it's not going to escape you or anybody listening to this, the impact that the pandemic had on just the way that we provide care in an industry that's already resource constrained, that became even further challenged by capacity issues that have lingered on now in areas such as long-term and acute skilled facilities. And the concept of how we provide a new modality of care, a new care experience that meets the patient where they are, in their home, at their workplace, that isn't so transactional based, but recognizes that care and the experience occurs before the appointment, during, and after, is really important. And the acceleration, both out of necessity and out of opportunity, of the use of digital solutions, ranging from telehealth to AI to new modalities of wearables, creates this opportunity to think about a new era of continuous health engagement and really producing health for patients, keeping them healthy, optimizing their wellness. But there's going to be challenges. And so I think what the playbook really was about was recognizing that we're all in this together, that the VA has some unique opportunities in the way that our organization exists in healthcare, our responsibility and our mission. And I think that it's about sharing what we've learned in an open and accessible format, but one that's also very practical.
Ryan, that's exactly right. And the way you give voice to that and the VA's priority on continuous health engagement and really providing complete and holistic care to veterans was why this collaboration and the partnership between DiMe and VA, I think, did yield such a practical resource for the field. You've done so much of this. We spend all of our time thinking about how can we use these tools and technologies, not to declare that we're improving things because we're using more tech, but because we look at the downstream effects and we insist that we don't use these tools and technologies until they are ready for prime time. And when we do, we are thinking about effectiveness, efficiency, access, and equity. And that builds on other work that we've done together, a framework that we've published where we talk about what is value in healthcare innovation. And we've really tried to bring that to the fore for folks in the Playbook Digital Healthcare.
I think there's a number of components for folks to consider, particularly as they're utilizing this playbook or even in their own journey in applying digital tools. A lot of what we're talking about is really not just moving care further upstream, but it's recognizing that we can make care much more of a journey and less of a transactional sort of incremental piece of both you show up at the hospital, we see you, we order some labs, and then there's a follow-up, and more about that prior to that visit and after that visit, there are things that are happening to that patient, both part of their experience as part of their overall health, that we can now be more engaged and enable them to be more of an owner of their actual care journey, but more of a participant as well. So I think you hit it on the idea that value is going to be very dynamic. We have to think about value to the health system and to the providers and equally to the patient, and recognizing that that's not always going to match up. We also, I think, in a big part of thinking through the application of the technologies in the playbook is in healthcare, really being in tune to knowing not just where something as a solution should be scaled, but also when and how. And when becomes really important. The idea that an AI algorithm tested on a specific population is ready to scale can actually cause harm. Because what we're seeing in study after study is that when you move beyond the study population, you may not actually be thinking about who was that study population. Was it actually representative of my population or of all the populations I care for? And so while the idea that AI can assist radiologists in better detecting early signs of cancer or pneumonia, it also has to be thought about being applied to broad ranges of populations, but also recognizing that the way that x-rays are taken vary from hospital to hospital. The way that radiologists read varies. Medicine's still much of an art as it is a science. And so I think a lot of this is thinking through how we take these technologies, carefully apply them into our workflows or create new meaningful workflows, and simultaneously think about the new care models, the new types of payment models that must be layered into this. So where digital is a part of the way that we deliver care. It's not the way, it's part of the experience, not the entirety of the experience.
Ryan, that's exactly right. And I think you've underscored some of the elements that folks will find in the playbook Digital Healthcare that really are practical, just like you said, that contemplate this idea that there's an enormous amount of power in, let's build on your example, artificial intelligence and machine learning. There are also risks, and we do provide that guide for folks to ask themselves, what are the questions you should be asking? What are the critical considerations? We are optimistic together about the promise of digital innovation to improve the way we care for people and improve the lives of the patients we're all here to serve, as well as the people and systems that care for them. We're also not tech determinists, and we've really tried to be thoughtful about the opportunity for everyone out in healthcare who is facing a staffing crisis. We're seeing challenges with deferred care. Ryan, you and I were talking about that just earlier today, with the ongoing challenges to affordability, access, health equity. Digital solutions aren't a silver bullet, but they can be powerful tools in the toolbox. And our hope in creating this together, this collaboration between DiMe and VA, was to share all of our learnings, including a number of case studies that folks will find, and that real practical action-oriented guide that folks can start using today. So Ryan, this was yet another collaboration that was a real pleasure. I'm very proud of what we've put out into the field. I'm proud that we've taken an approach of being open access so that anyone can start to use these tools. Folks on the line, you can find these resources at dimesociety.org. We also encourage you to join us at IEX this October, where VA will be showcasing some of their leading healthcare innovations. There's a lot we can learn from our colleagues at VA. We showcase that in the playbook and hope this is a valuable tool for you all. Thank you so much.